9 stages of kidney failure and the tests that save lives. 37 million. That is how many American adults are living with chronic kidney disease right now. But here's the terrifying statistic that should keep you up at night. 9 out of 10 of them don't even know they have it. Imagine losing 90% of a vital organ's function without feeling a single specific pain. No chest clutching, no sudden collapse, just a slow, silent fade. By the time you realize something is wrong, you may already be at the cliff's edge of end-stage renal disease, or ESRD. At that point, your options for survival narrow down to 2 drastic paths: a machine that cleans your blood 3 times a week, or waiting for a stranger to die so you can have their organ. Right now, over 88,000 people in the U.S. are battling end-stage kidney disease. The cost of keeping them alive? Over $40,000 a year per patient for dialysis. But the human cost is immeasurable. And we need to talk about who is at risk. This disease discriminates. If you are African American, you are nearly 4 times more likely to suffer from kidney failure than white Americans. If you are Hispanic or Latino, your risk is 1.3 times higher. Native Americans and Alaska Natives are also facing a crisis, driven largely by diabetes rates. But regardless of your background, if you miss the signs, the result is the same. In this comprehensive guide, we are not just listing symptoms. We are going deep into the biology of your body to explain exactly what happens when your kidneys fail. We will cover the 9 critical warning signs, the specific blood tests you must demand from your doctor, and the dark reality of the global transplant trade that no one talks about. You cannot afford to skip this video. Let's save your kidneys. The engine room. Understanding the failure. To understand why kidney failure is so dangerous, you have to understand what these organs actually do. You might think they just make urine, but that is a massive oversimplification. Your kidneys are the master chemists of your body. They filter 200 quarts of blood every single day. That's enough to fill a large bathtub. They remove acid that is produced by the cells of your body and maintain a healthy balance of water, salts, and minerals, such as sodium, calcium, phosphorus, and potassium, in your blood. When chronic kidney disease, CKD, hits stage 5, also known as end-stage renal disease, the factory shuts down. This leads to a condition called uremia. Uremia literally means urine in the blood. Because the kidneys can't filter the toxins, the waste that should have gone into the toilet stays in your veins. It poisons your tissues, your brain, and your muscles. This damage is often driven by 2 main culprits: high blood pressure, which pounds the delicate filtering units, glomeruli, in the kidneys until they scar over. Diabetes, high blood sugar, acts like slow-acting poison to the blood vessels in the kidneys. So how do you know if this is happening to you? The signs are subtle, but they are there if you know where to look. Here are the 9 warning signs. The 9 warning signs. Deep dive. Sign number 1. The fatigue that sleep won't fix. We aren't talking about being tired after a long day of work. We're talking about a bone-deep exhaustion that makes lifting a coffee cup feel like lifting a dumbbell. Why does this happen? It's a 2-pronged attack. First, the buildup of toxins and impurities in the blood causes a systemic sluggishness, but the second cause is more specific. Your kidneys produce a hormone called erythropoietin, or EPO. EPO tells your bone marrow to make red blood cells. When kidneys fail, EPO production drops. Fewer red blood cells mean less oxygen is being carried to your brain and muscles. This is anemia. If you are constantly exhausted and you also have diabetes or hypertension, this is a massive red flag. Sign number 2. The midnight cramps. Have you ever woken up screaming because your calf muscle locked up into a hard knot? Muscle cramps are incredibly common in stage 5 CKD. This is simple chemistry gone wrong. Your muscles rely on a perfect balance of electrolytes to contract and relax, specifically potassium, calcium, and magnesium. Hypocalcemia. Failing kidneys struggle to process vitamin D, which leads to low calcium. Hyperkalemia, they also struggle to clear potassium. Magnesium imbalances, often caused by the very treatments used for kidney issues. When these ratios are off, your nerves misfire, causing intense, painful cramping, usually in the legs. Sign number 3, edema, the swelling. Your kidneys are your body's drain pipe. When the drain is clogged, the water has nowhere to go. It starts to seep into your tissues. You might notice that your shoes feel tight in the afternoon, or your socks leave deep indentations in your ankles. This is edema. It happens because the kidneys can't remove excess sodium. Sodium holds onto water. In severe cases, this isn't just annoying, it's deadly. That fluid can back up into your lungs, pulmonary edema, or around your heart. If you press your thumb into your ankle and the pit stays there for a few seconds, that is pitting edema, and you need to see a doctor immediately. Sign number 4, the ammonia taste, metal mouth. This is one of the most disturbing symptoms. Patients often report that food tastes like metal or that their breath smells like urine. This is called dysgeusia. It happens because the urea level in your blood is so high that it is actually breaking down into ammonia in your saliva. Imagine having window cleaner in your mouth all day. That is what uremia tastes like. This leads to a dangerous cycle. Food tastes bad, so you don't eat. You lose weight. You develop protein energy wasting, where your body starts eating its own muscle for fuel because you aren't feeding it. Sign number 5, the bone-deep itch. This isn't an itch you can scratch away. It feels like it's under the skin. Doctors call this pruritus. It affects about 40% of dialysis patients. While we don't know the exact mechanism, we know it's linked to high levels of phosphorus. Healthy kidneys flush out extra phosphorus from the foods you eat, like dairy and nuts. Failing kidneys keep it all. The phosphorus binds with calcium in your blood, creating tiny crystal-like structures that deposit in the skin, causing a maddening, relentless itch that can ruin your sleep and mental health. Sign number 6, shortness of breath, dyspnea. Feeling air hunger or shortness of breath is scary. In kidney failure, this happens for 2 reasons. Fluid overload. As we mentioned, fluid backs up into the lungs. It's like you are slowly drowning from the inside. Anemia. Because you don't have enough red blood cells, your body is starving for oxygen, so you pant to try to get more air in. If you get winded walking to the mailbox, don't just assume you're out of shape. Check your kidneys. Sign number 7, brain fog and confusion. Your brain is incredibly sensitive to toxins. When the kidneys fail to filter the blood, uremic toxins cross the blood-brain barrier. This can manifest as memory trouble, difficulty concentrating, dizziness, in severe cases, seizures or coma. This is uremic encephalopathy. If you or a loved one with diabetes starts acting confused or sedated, this is a medical emergency. Sign number 8, urine changes. This seems obvious, but it's tricky. Some people with kidney failure stop urinating entirely, but others actually urinate more frequently, especially at night, nocturia. The catch? The urine is empty. It's mostly water, with very little waste filtered into it. Also, watch for foamy urine. This indicates protein is leaking into your toilet. Bubbles that require multiple flushes to go away are a sign of proteinuria. Blood. Brown or red urine means the filters are leaking blood cells. Sign number 9, skin discoloration. Finally, look at your skin. Pallor. A pale, ghostly look due to anemia. Hyperpigmentation. Patches of gray or dark skin. Uremic frost. In very late stages, the urea crystallizes on the skin as a white powder when sweat dries. It literally looks like snow on the skin. The tests. How to know for sure. If you have any of these symptoms, or if you are in a high-risk group, high BP, diabetes, family history, African American, Hispanic, Native American, you cannot wait for a physical exam. You need data. Here are the 3 specific tests you need to request. 1. The EGFR, estimated glomerular filtration rate. This is the gold standard. It's a mathematical calculation based on your blood creatinine, age, and gender. GFR 90 plus, healthy. GFR 60 to 89, mild damage. GFR 15 to 60, moderate to severe disease. GFR below 15, kidney failure. You need dialysis or a transplant. Knowing your number is the only way to track the decline. 2. Serum creatinine. Creatinine is a waste product from normal muscle wear and tear. Healthy kidneys filter it out easily. If your creatinine levels in the blood are rising, it means it's staying in your body. It is the red alert that the filtration system is backed up. 3. Albumin to creatinine ratio, urine test. This checks for protein in the urine. Remember, healthy kidneys keep protein in the blood to build muscle and repair tissue. Damaged kidneys let it leak out. If this test is positive, you have kidney damage, even if your GFR is still normal. 4th, ultrasound. This allows the doctor to see the physical size and shape of the kidneys. Are they shrunken, a sign of chronic disease? Are they swollen, a sign of obstruction? Part 4. Treatment and the harsh reality. If the tests come back with bad news and you reach stage 5, medicine alone is no longer enough. You're facing 3 roads. Road 1, hemodialysis. This is the most common path. You go to a clinic 3 or 4 times a week. 2 needles are inserted into a site in your arm, a fistula. Your blood is pulled out, run through a machine that acts as an artificial kidney, and pumped back in. The reality. It takes about 4 hours per session. It leaves you drained and washed out, a dialysis hangover. It is life-saving, but it is a part-time job that you can never quit. Road 2. Peritoneal dialysis. This is done at home. A catheter is surgically placed in your abdomen. You fill your belly with a cleansing fluid that pulls toxins out through the lining of your stomach, and then you drain it. The reality. It offers more freedom and can be done while you sleep, but it requires strict hygiene to avoid serious infections like peritonitis. Road 3. Kidney transplant. This is the holy grail. A new kidney restores function, ends the need for dialysis, and doubles the life expectancy compared to staying on the machine. The reality. It is not a cure, it is a treatment. You will need anti-rejection meds for life, and getting one is incredibly difficult. Part 5. The dark side of transplants. This brings us to a topic that is uncomfortable but necessary. Because the waiting lists in the US, UK, and Canada are years long, sometimes 5 to 10 years, some patients get desperate. They look for transplant tourism. They see ads for hospitals in countries like China that promise a matching organ in weeks or even days. You must stop and ask yourself, how is that possible? In ethical medical systems, you wait for a donor to die from an accident. You cannot schedule that. The only way to schedule a heart or kidney transplant on a specific day is if you know exactly when the donor is going to die. Credible investigations and human rights tribunals have presented overwhelming evidence that state-run hospitals in China have fueled a billion-dollar industry using the organs of prisoners of conscience, specifically Falun Gong practitioners, Uyghur Muslims, and other minority groups. These people are reportedly blood-tested and cataloged while in custody, effectively acting as a living organ bank. When a wealthy tourist arrives, a donor is executed. If you go this route, you risk not only major medical complications and a lack of follow-up care, but you may also be unknowingly complicit in a crime against humanity. Please stay within the legal, ethical donation systems of your country. It is a long road, but it is the right one. Part 6. Prevention and lifestyle. The goal of this video is not to scare you, but to empower you. If you are in stage 1, 2, or 3, you can slow this train down. You can stop the progression. 1. Blood pressure control. This is non-negotiable. Keep it under 130/80. High pressure shreds your filters. 2. Blood sugar management. If you are diabetic, your A1C is your lifeline. 3. Quit smoking. Smoking slows blood flow to the kidneys. It's like stepping on the gas pedal of kidney failure. 4. Diet. You need to become a label reader. Limit sodium, under 2,300 milligrams a day. Too much animal protein puts a heavy load on the kidneys. Hydration. Drink water, but don't overdo it if you are already retaining fluid. Conclusion and next steps. Kidney failure is a silent thief. It steals your energy, your time, and eventually your life, if you let it. But by watching this, you are already ahead of the 90% who don't know they have a problem. Monitor your fatigue, check your ankles for swelling, look at your urine, and most importantly, ask your doctor for your GFR number. But there is one massive piece of the puzzle we haven't solved yet: your diet. You might be eating healthy foods that are actually poison for people with kidney concerns. Avocados, brown rice, bananas. If your kidneys are struggling, these superfoods can actually be dangerous due to their potassium and phosphorus levels. You need to know exactly what to avoid. We break down the everyday items in your fridge that could be accelerating kidney damage and what to eat instead. Don't let a salad be the reason you end up on dialysis.